Yeah, Nitin, you may go live now.
Yeah. Dr. Mohini, ma'am, we'll start.
Yes. Okay.
Fine. Okay.
Yeah. You can start.
Yeah.
Good morning, ma'am. I'm Richa.
Hi. Hello. I'm Dr. Mohini.
Yeah, hi. So we're just starting.
Yeah. Okay.
Good afternoon, doctors. It's our absolute pleasure to welcome each one of you to this insightful webinar. We are honored to have such a distinguished gathering of medical professionals here today. So before we start today's discussion, allow me to introduce our company, Hetero Healthcare. Hetero Healthcare is determined to stay a step ahead to deliver superior and innovative care. Hetero Healthcare have established 300 products in the portfolio and pioneers in quality and innovation. We've also launched 4 biosimilar products within 5 years in the market and have strong global presence in over 126 countries. So the topic of today's webinar is enzymatic preparations with Papain advantage in dentistry. To shed the light, we are privileged to have Dr. Mohini Daultani with us. Welcome, ma'am.
Yeah. Thank you.
Dr. Mohini Daultani, MDS and gold medalist in the field of periodontology, implantology, and laser. She is an associate fellow in laser dentistry affiliate by WCLI USA. She is also the brand ambassador of Dental Research, Dental Reach Digital Magazine, and associate editor of Journal of Contemporary Research of Medical Sciences. She has also bagged the most prestigious awards. To name a few, Periodontist of the Year by FAMDent Excellence Dentistry Award 2021, 2024, Superstar Award by FAMDent Excellence Dentistry Award 2025. So we are highly privileged to have her amongst with all of us. She is a speaker at various platforms like Academy of Advanced Endodontics, Bangalore, ILAMED Academy, Mumbai. She's also a founder of Advanced Orthopedic and Dental Care, Vashi, and consultant periodontist at implantologist at Apollo Hospital, Navi Mumbai. Welcome, ma'am, for
Yeah. Thank you
this.
so much.
Yeah.
So,
So, doctor, you can please start the session.
yes, I'll just share the screen. Okay. Is it visible?
Yes, ma'am.
Yeah. Yes.
Okay. So, good afternoon, everyone. Myself, Dr. Mohini Daultani. So, we are going to have the presentation on enzymatic preparation with Papain advantage. This is the following content that we'll be covering. That's inflammation, process of inflammation, wound healing process, the need, and the product profile. So to start with, what is inflammation? It is actually to mean to set on fire. So it is actually a localized reaction as a result of your physical trauma or irritating chemicals or the infection by either bacteria and viruses or injury. So the inflammatory response that happens is a natural defense mechanism that is triggered whenever your body tissue gets damaged in any form. So inflammation are of basically two types. It could be either external or internal. So what is our main goal? It is aimed to eliminate the initial cause of your cell injury, to remove the necrotic cells and tissue, and to initiate the healing process. So when does inflammation happen in your body? It will happen when you undergo by any kind of physical injury or stress or trauma or burns, post-operative wound healing, bacteria, viral infection, or insect bites. So whenever this all happen, you will have a response that is called as an inflammation. So there are basically 5 cardinal signs of inflammation. First is your heat, that's calor. Then you have redness, that's rubor. Then that's swelling, that's edema. Pain, known as dolor, and loss of function. So more the cardinal sign of inflammation present, more acute is the problem. So it can last for either few minutes or even few years. So how does the process of inflammation occur? As you could see in this diagram, we have a bacteria. Whenever a bacteria come in, it will trigger macrophages. So this is your macrophage. What is macrophage doing? It's releasing chemokine as well as cytokine. Once the chemokine and cytokine go inside the blood vessel, there is a vasodilation. and increase vascular permeability, causing redness, heat, and swelling. So these inflammatory cells that have come out will migrate into the tissue, releasing inflammatory mediators and causing finally a pain. These signs are due to the movement of your plasma fluid. As you could see, this plasma fluid, proteins, and inflammatory cells from lumen of your vascular system out into the tissues. That is the reason the inflammation occur and you get pain. So there are basically two types of inflammation, acute and chronic. So what is acute? Basically, it will start very rapidly. The onset is rapid in action and quickly becomes severe. So what are the signs and symptoms? They are only present for few days, but in some cases, there could be persisting till few weeks. So you have vasodilation, increased vascular permeability, emigration of leukocytes, mainly neutrophil, and their accumulation at the site of injury. So what are the examples of your acute inflammation? It's acute bronchitis, sore throat, acute tonsillitis, and acute sinusitis. Now coming to the chronic inflammation. It is inflammation of your prolonged duration that could last from weeks to months. So your lymphocytes, macrophages, infiltration, tissue destruction by inflammatory cells, repair with fibrosis and angiogenesis. This all happens in your chronic inflammation. Many of the changes are also present in your repair process. So chronic inflammation does not have more of your rubor or calor as in case of your acute infection. But also remember, it can result from your failure to eliminate whatever was the cause of an acute inflammation. And in autoimmune response to self-antigen, the immune system attacks healthy tissue, mistaking them for the harmful pathogen, and a chronic irritant of your low intensity that still persists for a longer duration. So coming to the next, that is, what are the second. What are the mediators of your inflammation? You have chemical mediator, as we saw in the diagram, any messenger that acts on your blood vessels or inflammatory cells to other cells to contribute. So you have basically two types of inflammation. One is plasma derived and other is cell derived. So in your plasma derived, you have complement proteins, kinins circulating in inactive form, typically undergo proteolytic cleavage to acquire their biologic activities. The next is cell derived. So cell derived are basically sequestered in intracellular granules, rapidly secreted upon cellular activation, or are synthesized de novo in response to a stimulus. So as you could see in this diagram, you have mediators of inflammation, cell derived and plasma derived. So in cell derived, you have mediators such as histamine, serotonin, and the others are newly synthesized. That includes prostaglandins, leukotrienes, platelet activating factor, reactive oxygen species, nitric oxide, cytokine, and neuropeptide. Whereas plasma derived, as you could see, it includes complement activation such as C3A, C5A, C3B, and C5B. Then you have factor 12 known as Hegeman factor that includes kinin system and coagulation. So in your cell-derived mediators such as histamine, their main action is vasodilation and increased vascular permeability. Then you have serotonin from platelets that will cause vasoconstriction. Then you have prostaglandins from mast cells that will cause vasodilation, pain, and fever. Leukotriene from mast cell will cause increased vascular permeability, leukocyte adhesion and activation, and chemotaxis. The next is platelet activating factor from leukocytes and mast cell that again will cause vasodilation and increased vascular permeability. The next is reactive oxygen species known as ROS from leukocyte that will cause killing of your microbes and tissue damage. The next is nitric oxide from endothelium or macrophage that will cause vascular smooth muscle relaxation. Then you have cytokines such as TNF, interleukin 1 and 6 from endothelium and macrophage. They basically cause your endothelial activation or result in your fever, metabolic abnormalities, or shock. The last is chemokine derived from your leukocytes and macrophages that results in chemotaxis and leukocyte activation. So plasma-derived mediators are your complement system that will cause leukocyte chemotaxis and activation and direct target killing and vasodilation. The next is kinin from plasma that will cause increased vascular permeability, smooth muscle contraction, vasodilation, and pain. The next is protease activated coagulation from plasma that results in endothelial activation and leukocyte recruitment. So to sum up, you have this complete chart flow. So coming to this mediator, tissue injury, whenever you you have a tissue injury or infection, so what happens? You have cells like macrophage, dendritic cells, and Kupffer cells and mast cells, they all get activated. So they are your basically chemokines. So the next, that is cytokines and prostaglandins, what do? They release all the inflammatory mediators responsible for your clinical sign of inflammation. So once this all happen, there is a vasodilation that results in increased blood flow, causing redness and increased heat, that's calor. Also, there is increased vascular permeability, resulting in exudation of plasma protein and fluid into tissue, causing swelling that will manifest itself as a tumor. The mediator molecule also alter the blood vessels to permit the migration of your leukocyte, mainly neutrophil and macrophage, outside of the blood vessel into tissue. And later, there is release of all the mediators such as bradykinin that will actually increase the sensitivity to pain. So even if the inflammation is a protective mechanism, but it can be potentially damaging. Inflammatory process can destroy or damage your normal tissue, especially if not controlled or not required. Therefore, you need to treat it. So coming to the treatment part, just let us have a highlight of injury and wound healing. Coming to injury, an injury is a damage to your body. It is a general term that refers to harm caused by accident, falls, hits, and more. This injury range from minor to life-threatening. Injury can happen at work or play, indoor or outdoor, driving car or walking across the streets. So whenever you get an injury, there is a wound. So what is a wound? It's a breakdown in the protective function of your skin, loss of continuity of epithelium with or without loss of underlying connective tissue, falling injury to the skin or underlying tissue or organ caused by surgery, sutures, cut, chemicals, heat, cold, friction, shear force as a result of your disease. So what is the wound healing process? It basically comprises of your four phases. Hemostasis phase is where your blood clot happens. Next is your inflammatory phase, where there is inflammatory means you have fibroblast, macrophage coming up inside. Then you have proliferative phase, where there is a lot of proliferation of your fibroblast. And finally, there is remodeling, where you get completely healed epidermis as well as dermis. So to sum up, you have first phase, as I said you, hemostasis. Here, the platelet play a very important role. In aggregation, they will release your cytokine, chemokine, and hormone. So platelet come in contact with collagen, and that is how you get a very fresh clot formation. During this, platelets degranulate and release chemotactic and growth factor, such as platelet-derived growth factor, protease, and serotonin and histamine. These will attract all the inflammatory cells to the area, leading to next phase. Next is your inflammatory phase. So it focuses basically here, all the bacteria will get destroyed by your neutrophil and will remove all the debris by macrophages, preparing the wound bed for the growth of new tissue. There is increased vascular permeability and vasodilation. Plasminogen is converted to plasmin, a potent enzyme that will aid in cell lysis. Macrophages also secrete collagenase and elastase that will break down injured tissue and release cytokines. Macrophage attract endothelial cells to the wound and stimulate their proliferation to promote angiogenesis. This phase lasts for around 4 to 6 days and is associated with your redness, edema, heat, and pain. Next, you have got is proliferative. As the name suggests, you get proliferations. So you have different subphases such as fibroplasia, matrix deposition, angiogenesis, reepithelization. In 5 to 7 days, fibroblasts will migrate into the wound and will lay down all the new collagen. The wound is filled with GAGs and fibronectin that is produced by fibroblast. Proteoglycans are GAGs that are bonded to a protein and will cause matrix deposition. New blood vessels are formed, reepithelialization occur with the migration of your cells from the periphery of the wound, and the wound margins contract and pull towards the center. The wound is covered with epithelium. The proliferative phase often lasts for around 4 to 24 days. Next is remodeling phase. After the third week, the wound undergoes constant alteration. That's called as remodeling. That will last for years after the initial injury has occurred, during which the dermis produced collagen and matrix protein can then return to its pre-injury structure. Contracting of the wound is an ongoing process resulting in the proliferation of myofibroblast, which resemble contractile smooth muscle cell. The tissue remodels and matures, and there is an overall increase in your tensile strength. But what is the concern when it comes to your inflammation and pain? In generally, pain is a symptom of some form of dysfunction and result in inflammatory process in your body. Many agents are available to reduce inflammation and pain, but their chronic use can lead to various side effects. Over the past few years, researchers have suggested the role of more natural and safe alternatives for the management of your pain and inflammation. Recent studies have shown that enzyme combination is very important and safe in relieving your edema, inflammation, and promoting wound healing. But if there is inadequate wound healing and non-healing ulcer, that can cause a serious problem and impact human health. So wound healing can be delayed if your necrotic tissues are left in the wound site, and therefore wound debridement is necessary to remove this necrotic tissue, cellular waste, and harmful exudate. Among the various debridement methods, you have enzymatic debridement that has shown to be very, very clinical effective for removing the necrotic tissue. So the current need goes with your complete combination approach. First is you can improve the inflammation and pain management. That will cause also faster wound healing, and there are less side effects as compared to other agents. So that is the beauty of your enzymatic degradation. So for that, we have come up with a very beautiful product that is your Tolib, and that is comprising of your papain, rutin, trypsin, and bromelain. So trypsin is around 96 milligram, bromelain is 180 milligram, papain is 120, and rutoside is 200 milligram. How does this all help out? We'll have a look in detail. So this Tolib can be used to reduce your edema, inflammation. You can use it after post-operative oral and implant surgeries, for wound healing, for jaw fractures, and disimpaction. So that can be taken twice a day for 5 days. That is the course duration after your food. So how does this proteolytic enzyme work? Enzymes are proteins that will speed up your chemical reaction in your living organism. As enzyme act as a catalyst for specific chemical reaction, it will convert specific set of reactants into specific products. So proteolytic enzymes such as proteinases and proteases are proteins basically capable of hydrolyzing the peptide bonds of your protein. Certain proteolytic enzymes have anti-inflammatory and anti-edematous properties, indicating their benefit in inflammatory condition, oncology, and immune regulation. So what are those sources? From plant-derived it is, that is your papain and bromelain. Animal-derived is your trypsin, chymotrypsin, pepsin, and rennin. Bacterial, you have serratiopeptidase and subtiline. And from fungal, you have aspergillogellin, pepsin. So basically, trypsin, bromelain, papain together have shown a very excellent anti-inflammatory property and analgesic effect. So coming to your first combination, that's your content is your trypsin. So trypsin is a serine proteases enzyme produced by pancreas. It is a globular protein produced as an inactive proenzyme called as trypsinogen. It consists of a single chain polypeptide of 223 amino acid residue. It is secreted into the duodenum via the pancreatic duct. Once the duodenum, the enzyme enteropeptidase activates into trypsin by proteolytic cleavage. Trypsin in the duodenum catalyzes the hydrolysis of peptide bond so that the protein can be broken down into the smaller peptides. Trypsin continues the process of your digestion in the small intestine, where a slightly alkaline environment will promote its maximal enzymatic activity. Here, that pH is around 7 to 9. Coming to the next, that is trypsin. What is the mode of action? Basically, its anti-inflammatory effect of trypsin is due to inhibitory action of your vascular permeability and lowering the pro-inflammatory cytokines such as TNF-alpha, interleukin-1, and interferon gamma. So trypsin basically will enhance your fibrinolysis. Trypsin has been shown to modulate cytokine level in burns. So the therapeutic uses, trypsin is used for your wound and ulcer cleansing to remove all the necrotic tissue and debris and enhance wound healing. Trypsin possesses anti-inflammatory and thrombolytic activity. And also the studies indicate that there is a good result in therapy of your diabetic cellulitis with chronic infected leg ulcer, rheumatoid arthritis, and variety of your ocular disorder. Coming to the next content, that is bromelain. So it belongs to a group of protein digesting enzyme called as cysteine proteases. It is obtained commercially as a crude aqueous extract obtained from the stem and fruit to the pineapple. So bromelain can be absorbed in your human intestine without degradation and without losing its biological activity. So that's the beauty of your bromelain. Also, bromelain exhibit anti-inflammatory activity, anti-edematous, anti-thrombotic, and fibrinolytic activity. So what is the mode of action with bromelain? It shows excellent analgesic and anti-inflammatory effect due to inhibition of arachidonic acid pathway. So selectively, it will decrease thromboxane generation, inhibiting the PGE2. Inhibition of your pro-inflammatory mediator, bradykinin, at the site of your inflammation will result in reduced vascular permeability and thus will reduce edema and pain, limiting the formation of your fibrin by reduction of clotting cascade. Bromelain will influence inflammatory, clotting, and pain process. So what are the uses of your bromelain? It plays a very important role specifically in cases of your chronic inflammation. It is used as an anti-inflammatory analgesic agent. It is used for acute inflammation and sports injury. It is beneficial for debridement of necrotic tissue and acceleration of your healing. Also, bromelain before a surgery can reduce the average number of days for complete disappearance of pain and post-surgery inflammation. Coming to the next content, that's your papain. It's basically a cysteine protease enzyme found naturally in papaya and is manufactured from the latex of your raw papaya fruit. The greener the fruit, more active is the papain. Papain shows extensive proteolytic activity towards protein as it has a short chain peptide, amino acid ester, and amine linkage. It is a single chain globular that consists of 212 amino acids with 4 disulfide bond. It is stable and active even at elevated temperature. Optimum pH for activity is a range of 3 to 12. So what is the mode of action? It possesses analgesic and anti-inflammatory activity. Papain acts as a debris removing agent, effectively separates devitalized tissue, bacteria, and blood from the wound surface. With no harmful effect on sound tissue because of the enzyme specificity, acting only on tissue that lacks around your alpha-1 antitrypsin plasmatic antiprotease that inhibits your proteolysis in healthy tissue. Papain basically aids in your wound regeneration and promotes collagen formation. It also possesses antibacterial and antifungal activity that reduces bioburden from wound. So papain basically has your analgesic effect, anti-inflammatory activity, and acts as a debris removing agent. So what are the effects of your papain? It has a very long history to treat your sports injury, trauma, and allergies. Papain will reduce pain, body temperature, decrease inflammatory reaction at the wound site with burn, diabetic foot ulcer, leg ulcer, and pressure. Papain had the following advantage in burn care. It decreases the need for surgical debridement with its risk of blood loss and operative complication. It is effective in desloughing the necrotic tissue. Also, it prevents the burn wound infection. Coming to your last content, that is rutoside, known as rutil. So it's a natural flavored derivative abundantly found in plants such as buckwheat, tea, and apple. So it has a powerful antioxidant for in chronic inflammatory condition. It also possesses antibacterial activity, antidiarrheal activity, anti-ulcer, and myocardial protective, cytoprotective, and vasoprotective. Plasma level of your rutoside decreases rapidly after oral administration. Ingested rutoside is hydrolyzed to quercetin in the intestine and further changed to other conjugated metabolites of quercetin. Rutoside results in generation of more than 60 metabolites that reduce the production of cytokine, interleukin 1 beta, and TNF alpha. So what is the mode of action of your rutoside? It shows excellent anti-inflammatory and anti-allergic activity. It causes inhibition of your platelet aggregation, decreasing the vascular permeability. It will improve your vascular flow, improving the circulation. It will strengthen the capillary and preventing edema. It will combat the harmful free radicals such as nitric oxide released during the inflammatory process, suppression of your major inflammatory and pro-arthritic mediators of macrophages such as interleukin 1 beta and TNF alpha. So basically, your rutoside will influence the pro-inflammatory and healing process. So what are the therapeutic uses? It will reduce the oxidative stress in wound area. It will enhance the wound healing and promote the formation of your new epithelium and thicker granulation tissue, which is closer to your original epithelial tissue when used as a wound dressing. It also reduces inflammatory manifestation in human arthritis and inflammatory disease. So what are the special precaution when it comes to TOLIP? Yes, you have to take care when you are trying to give it in combination. Basically, papain and bromelain can increase the blood thinning effect of warfarin. Bromelain should not be mixed with your sedative drugs at all. Also, for pregnancy and lactation, we ideally say not to use it. We don't have all the articles supporting it, but safer side, you're not supposed to use it in cases of pregnant and lactating mothers. So what is the safety of TPBR combination? Trypsin is regarded as a safe substance. Next, bromelain is non-toxic without any side effect. So that is also supporting all the clinical trials. Rutoside is safe and well tolerated with few side effects such as dizziness, headache or diarrhea, stomach upset. Enzyme rutoside combination exhibits better safety and tolerability as compared to your NSAIDs. So what are the benefits of your TPBR combination? It will decrease the capillary permeability and prevent edema. It decreases inflammatory response. It decreases clot-forming fibrin deposits, improves blood circulation, improves healing and tissue repair, strengthens the capillary wall, equivalent analgesic activity to NSAIDs, shows antioxidant effects. So TPBR provides effective relief in terms of pain, swelling, inflammation, and wound healing. So there are a few articles supporting it. So trypsin, rutoside, and bromelain are fixed dose combination, a natural, safer, and effective anti-inflammatory agent. So according to this, considering the above facts, the use of drug of natural origin with lesser hazard is a positive alternative. Bromelain, rutoside, and trypsin are known to have a very promising role in relieving inflammation and promoting the wound healing. The bromelain, rutoside, and trypsin combination might be safer alternative in comparison to other drugs used for musculoskeletal condition. The next article, that is impact of a systemic enzyme supplementation on low-grade inflammation in humans. So basically, what did this study show? That this study suggests that the short-term supplementation with your systemic enzyme can be and may accentuate the subclinical inflammation with perhaps greater effect among men as compared to women's. The next article is bromelain. That's about the biochemistry, pharmacology, and medical use. So basically, they say that due to its efficacy after oral administration, its safety and lack of undesired side effect, bromelain has earned a high growing acceptance and compliance among the patients and phytotherapeutical drug. It is also true that bromelain effects on modulation of your immune function, its potential to eliminate burn debris and accelerate the wound healing. The next is efficacy of your papain-based wound cleanser in promoting the wound regeneration. So what does this study suggest? That you get better collagen deposition and presence of skin organelles in rats treated with papain-based wound healing. So wound healing effect, papain-based wound cleanser is also integrated with antibacterial property that makes it as a complete package for your wound management. So this is the complete end of your presentation. I hope I could have added light to your enzymatic addition, of which Tolib is one of the best to go for. And I personally use it in all my cases after post-operative surgeries, and I get beautiful results. And as well as the patients are super happy with it.
Doctors in the audience can type in their question. If you have any questions, you can type in. That message will directly go to Dr. Mohini ma'am. Any questions from the audience? Okay, so far no questions. So yeah, we would like to thank Mohini ma'am for this knowledgeable and insightful session and helping us understand Tolib in a better way. And thank you for your time as well.
Yeah, thank you so much,
Thank you,
Edwin.
participants, for joining in on a weekday.
Yes, that's more important, I think.
Yeah.
Yeah.
Yeah. Thank you, ma'am. Thank you
everyone.
so much.
Thank
Yeah.
you. Yeah.